Hi, welcome to 5-minute videos for the National Counseling Examination Review. This is Dr. Pepe. Today we are covering Domain 2, Intake Assessment and Diagnosis, and we are going to cover subdomain M, which says select, use, and interpret appropriate assessment instruments. So assessing is a key of the intake process, and not just the intake process. Many assessments can be done in different intervals of the counseling process. But for the purposes of answering this subdomain, let's look at first of all, what are some assessments? How can they be relevant? How can they help the therapeutic process, as well as how to interpret them? So how to select tools for an assessment. So first of all, as a clinician, you have to understand the many different tools that are available. You have to understand the different guidelines. I know the APA, they publish the assessment handbook, which gives you kind of a breakdown of the reliability, validity, coefficients, as well as how do they correlate with other assessments. So such tools such as those would be good to understand, so that you can explain to the client, that this assessment is being assessed for the purpose of blank. I've looked at some of the quantitative data, and then these assessment gives me this types of reliability data. So for the purpose of answering this subcategory, understand that assessment tools should be selected for their relevance to the situation. And again, before I give any assessment, I want to explain to the client why the rationale for that assessment to be given, and I want them to understand that this is just a tool. It's not anything encompassing or anything that's going to be all encompassed, because no assessment is, but it's just a tool so that they can get some quantitative data to go along with some of the qualitative data. Many times a client may not see the progress that they're making. You may see it, but a client may not. So an assessment, for example, would be a tool that you would consider in that case, so that the client can see, at the beginning of therapy, the Beck Depression Inventory said you were, at a high number. And now, based on this same assessment with, 0.9 reliability coefficient, so we know it's pretty good. Now it's saying that the symptoms are at a moderate. So even though you're still feeling you're still exhibiting symptoms, this assessment tells us that the symptoms are not as severe. Other things to keep in mind are that the ability to help the assessor make inferences, right? Is the therapy working? Are the techniques that are being implemented making a quantifiable difference for this client? And if not, then that's something to consider, right? You want to use evidence-based techniques. You want to have a theoretical orientation that is backed up by evidence-based techniques. So there are many tools, many assessments, but for counseling purposes, again, it's very important for you to understand what those assessments are, being able to interpret the raw data so that the client understands, as well as being able to review, what is reliability, what is validity, how can I express that to my client so that they understand, what that means, and how these tools can assist in the therapeutic process.